think connecting with this community and staying really involved has been very, very helpful because it's good to keep hearing those reminders that that doesn't always work for us. That's okay if it's not the usual way of doing things. You're not doing anything wrong and you're not weird. And also just a lot of like comorbidity issues. I've got a few other health issues that cross over. And I recently learned about some more that's common in the community.
Like so many people go in to see different doctors. Like they're like, oh, I'm having anxiety, I'll go to see a psychiatrist, or I'm having gut health issues, I'll go see my GP or whatever. And they never make the connection because, as we talked about in the beginning, there's no education about the comorbidities and the crossovers. And if you have ADHD, you're more likely to have this. And if you're a woman with ADHD, you're more likely to have this. Like being tapped into the community is so helpful for learning those things. And just being able to bring it up with your doctor and being like, oh, maybe there is a connection, because where else would you get that information?
Yeah. Even studying in school, I loved the neuroscience component of it. For me, once I made that click of how it's more of a dopamine threshold, and that's your whole nervous system, and brain-body connection was already something I was very interested in learning about when I was dealing with depression and anxiety. And then this just kind of put it even more into perspective. Dr. Dotson shared a presentation at a group I went to about how we have interest-based nervous systems.
Yes. Yeah.
And I loved that because it puts so much more into perspective when people say things like, it's in your head, it's in your body, it's in your health, and we have to work with that.
I'm with you. I suffer from chronic migraines and joint issues, and it's already hard enough to manage the ADHD, but then you have those other things that come up. Sometimes I feel like it's a full-time job to manage like body, mind, and health.
I've got a foot in a soft cast all month because of a sprained ankle.
That's, you
that ties back to ADHD.
And I was like, she has ADHD. The fact that she sprained her ankle is not shocking to me whatsoever.
I actually sprained it twice.
Oh my gosh.
And then I learned from some friends at the conference that yet another comorbidity, Ehlers-Danlos, is really common with ADHD. And it was another moment where I'm looking this up and I'm like, okay, check. A friend described her knee popping out the same way my ankles do. Sorry if it's getting weird for some people.
No.
Like, I'm trying to share this information. Like, nobody ever told me this. I've got these loose ankle issues and I'm walking down the stairs and I'm thinking about what plates I need to order and like forget how to walk and just fall off the stairs. And this is what happens to us.
That proprioception piece. Yeah.
Get
Get distracted by one thing and then the body goes another direction.
And then there goes my month, because as hard as I work to keep white space in my calendar and keep things flexible, it's like, well, I wasn't planning on being like physically disabled, and it just makes everything so much harder.
When you were talking about your Roman Empire, I was thinking about mine, and that's the connection between hormones and ADHD, and the fact that no one connects the fact that emotion dysregulation, if you're a person with a uterus, when you're ovulating, can impact your ADHD symptoms and make them worse.
Yes.
That's my Roman Empire.
Yeah.
As I was like discovering one thing and thinking about like how my brain works and what works for me, I'm finding all these other connections to other things. And it's like a full-time job to manage all this stuff.